which is series of webinar in collaboration with Parul University and Homeopathy 360. I am Dr. Alpesh Deswal, Associate Professor in Organ Medicine Department at Parul Institute of Homeopathy Research, and it's my pleasure to be your host for this session. Before we start the today's discussion, I had like to take a moment of introduce our esteemed speaker, Dr. Kamal Patidar. Dr. Kamal Patidar is an associate professor in Department of Repertory and Case Taking at Parul Institute of Homeopathy and Research, Parul University. And also he is an NABH coordinator and hospital in charge at Parul Institute of Homeopathy Research Hospital. Dr. Kamal Patidar is an experienced clinician. Under his guidance, so many camps and hospital activities are done in remote and village areas for promoting homeopathy to all the people. He has also published so many articles in reputed journals of India. Today, Dr. Kamal Patidar will be sharing insights on very important topic, role of NABH standards in homeopathy. When we talk about the standards, when we talk about the quality in homeopathy, NABH is the benchmark. So we are privileged to have them with us, and I am sure this session will be both informative and engaging. Let's welcome Dr. Kamal Patidar. Over to you, sir. Now you can start the session, sir.
First of all, good evening to all of you. I am very much thankful to the Homeopathy 360 and management of Parul University for providing such chance. I'm also thankful to Dr. Alpesh Deswal and Dr. Mansi for coordinating this seminar. So before starting my presentation, the PPT is visible or not?
Yes, sir. PPT is visible. Now you can on the camera also, sir.
Okay.
Yes, sir.
So,
Done.
So what is the NABH? First of all, the NABH is nothing but the National Accreditation Board for Hospital and Healthcare Provider, which is a constituted board of Quality Council of India, which is established in 2005 for the basic function of this is the accreditation of the hospitals and healthcare providers. Slide is not working. PowerPoint.
Sir, PowerPoint move नहीं हुआ.
Next slide is not.
Screen there.
So what is the NABH? The NABH, the full form of NABH is National Accreditation Boards for Hospital and Healthcare Provider. So is NABH is mandatory for homeopathy hospitals? So yeah, of course, yes. In current MES 2024, the NCH have recommended to all the homeopathy colleges hospitals should be NABH accreditation. So NABH accreditation voluntary process, and therefore it is the entire to healthcare organization whether to adopt or it or not. It is a mandatory. So what is the mission of NABH? So first of all, it improves the healthcare quality and patient safety. So in the previous day, we have see या फिर हमने देखा है कि in previous समाज में hospitals can be patient safety for.
Sorry sir disturbing you, but sir screen visible नहीं है. एक बार check करो.
Okay. Now visible?
Yes, sir.
पावर पॉइंट आगे नहीं बढ़ रहा अब इससे, हो रहा हो. So
Yes,
is
sir. But
NABH,
अब
is
हो रहा है.
NABH is mandatory? So in current MES 2024, it is a mandatory for all hospitals and have to NABH entry level accreditation. So what is the mission of NABH? So first of all, the main mission of NABH is the patient safety and healthcare quality. So NABH is a benchmark for the healthcare organization for which majority of we have worked on the patient safety, pure and quality purpose. So what is the importance of for the NABH accreditation? So NABH accreditations works on the patient safety and care quality. In all hospitals, we have the main focus on the patient safety and main on the care quality. Second one is for the hospital reputation and trust. Promote continuous improvement, facilitate medical tourism, and ensure legal and regulatory compliance. So this is a basic for the NABH. So what are the benefits for the patients? So NABH में सबसे ज़्यादा benefits होते हैं patients, patient के relative and साथ ही जितने भी stakeholders होते हैं. For the patients benefits, we have uh, for the patient's benefit, the quality of care and the patient safety is main focus. So in the NABH hospitals, all the medical staff should have the credential policies. They have allotted their works. So the patient have the rights to patients of the rights and they have know what are the satisfactory for hospital or not. So for the NABH, we have improved workplace, higher satisfaction staff, professional development, job security, as well as medical value travel boards, awards, and other recognition. So now we will focus upon the what is the NABH in the homeopathic healthcare hospitals. So in 2016 editions, so this is a standards book of NABH in which the 10 chapters, 104 standards, and 675 objective elements. So in 10 chapters, so all chapters have the framework regarding the quality assurance and quality improvement. And this is basically focus on the patient safety and quality care of the patients. All standards have the follow in the all organizations. So in the 10 chapters, the 5 chapters are related to patient-centric standards chapters. So in the five chapters, the patient-centric standards are the AAC. That means assess, assessment, and continuity of the care. So how you will be assess the patients, how you assess the after the assess, what you will be assessment, and how you are the continuity of the care in the follow-up. In this chapter, there are 14 standards and 96 objective elements. The second chapter related to patient's right and education, PRE. That means what are the patient's rights in the hospitals. So in this chapters, total 23 standards. Sorry, second chapter was the care of the patient. Third was the patient rights. So in the care of patient, there are 23 standards and 158 standards. And in the PRE, total there are 11 standards and 68 objective elements, which I have shown in the next slides. Next chapter is the management of medications. In these chapters, there are 8 standards and 54 objective elements. Next is a management-centric and hospital-centric standards chapters, that is a continuous quality improvement CQI. In these chapters, there are total 9 standards and 59 objective elements. Next, 7 chapters. 7 chapter is ROM, responsibility of management. In this, there are 6 standards and 39 objective elements. Next, facility management and safety, in which 7 standards and total 51 objective elements. Next, 9th chapter is human resource management, HRM. So in this chapter, total 10 standards and 52 objective elements. Last is the information management system, that is IMS. In this chapter, total 7 standards and 45 objective elements. So we have discussed about patient-centric standards and SEO management standards. So the patient-centric standards basically focus on the patient's care, patient's quality, safety, and all these things. And the next 6, 7, 8, 9, 10 are basically deal with the management standards. So first chapter is assess, assessment, and continuity of care. So in this chapter, we have, this chapter is mainly focused on the what are the patients informed services in this hospital, in this organization, the scope of healthcare, and including diagnostic and therapeutic services should be well defined. At any hospital, what are the area in which the hospital are work? Next, only those patients who can be cared for the organization are admitted. The hospital which have given the scope, only those patients are come for this hospital. So we have talked about in the AAC, there are 14 standards. So standard 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So in all the standards, there are certain objective elements. So for which all the SOPs, hospitals are running. So in the first AAC 1, so organization defines and displays the healthcare services that is provided. So in AAC 1, what are the scope of the hospitals are basically shown in the healthcare provider. What are the scope and what services they are offer and what services they are not offer. Second, AC2, the organization has a well-defined registration and admission process. So after the scope, the next, the duty is, so what is the proper registration process and the admission process in both OPD as well as IPD. So hospital SCO have the well-defined registration process and admission process for all this. If any patients come without any scope for these services, so we have referred to the patient to the higher center. The AAC third will deal with the appropriate mechanism for transfer in and out or refer to the patients. So in AAC 3, what are these? How you will be transfer one patient from the other department, same in or out. In the hospital, if a patients come in the primary registration, if it shows the registration is done under the surgery ward, medicine ward. So after sub-treatment, we have a transference mechanism by which we have got transfer one patient to the another shift. Other if some condition are critical, so how we have the refer policy for the patients. Next, AAC 4, in which the patient's care for the organization undergo the established initial assessment. So it is a very important for AAC 4 defines what are the initial assessment. After coming the patient in the hospital, what are the time period by which the patient were assessed after registration to the OPD. Next, AAC 5, the patient's care by the organization under the regular reassessment. So in this SOP, in these standards, the patient's care should be undergo a regular reassessment. Regular follow. In AAC 6, laboratory services, which lab services we have provided for the hospitals. So laboratory services, which type of test we will done? Regular test, which type of biochemistry test, which type of microbiology test, which type of serological test, what is the turnaround time, what is the critical value, all this seen in this AAC laboratory test shall be provided as per the scope. AAC 7 deal with the established laboratory quality assurance program. So in a laboratory, all the equipment, all the machines should be well calibrated and our assurance program all the tests are the genuine and reliable. In the AAC 8, the laboratory safety program. So in AC 8, both for the patient, both for the staff, what is the safety program in the laboratory? If a person is taking the blood sample from the patients, suppose a needle stick injury, other thing happened. So what are the safety program? Yeah, other thing, yeah, in the lab, suddenly there are electric shortcuts. So what are the basic safety program for both the staff and the for the patients? AC 9 dealing with the same radiology. AC 9, 10 and 11 dealing with the radiological services. That means X-ray, CT scan, MRI. So all these things are what are the basic tests? Yeah, what are the policies for this? We have provide what are the imaging services we will offer. Same like laboratory safety program in AC 11, the hospital yeah, healthcare provider shall having the safety program from imaging center. AC 12 is a patient's care is continuous and multidisciplinary nature. So in AC 12, the patient's care is a continuous. You have not any background for the treatment. So the continuity of care is the main. So AC 13 deal with the documented discharge policy processes. That means when a patient is admitted in the hospital, in what after the complete treatment, what are the discharge procedure? How you will be discharge the patients for it is a regular discharge, yeah, DAMA discharge, yeah, other discharge. So all the what are the discharge policies? In the discharge process, all the documents are well maintained and segregated. Then organized defines the content of discharge summary. In the discharge summary, all the treatment, yeah, all these service treatment taken by the patients have the written in the summarized form. Like in the AAC, for the initial assessment, what the OPD digestional chart shows when the patients come on the registration desk, yeah, hospital desk, so registration counter having the specific area which is known as the triage area by which we have identified the patients on the basis of their symptoms, yeah, on the basis of their disease. And after this, we have segregate, yeah, registered the patients as per the department and sent to the consultant room, yeah, inpatient department, procedure room, sample correction center, yeah, pharmacy, yeah, if yeah, after completing this, the exit. Like same thing, if a doctor in the OPD give the advice for the admission, so the patients have a directional charts. That means what are the enrolled, the IPD registration process, admission, which consultant, which admit, uh, in which department patient are admitted, what are the treatment investigations, what are the procedures, patients are discharged under the normal condition, yeah, LAMA, the other child, yeah, we are patients to the other facilities or have the yeah, patient have normal discharge, yeah, patient have the rate. So these are the directional charts regarding the IPD admissions. Now we talk upon the care of patients. It is a very essential and crucial standards in chapters in which the main focus on the patient's care and safety. So in COP, the organization या SCO provides the uniform care to the all patient in various settings. ऐसा नहीं कि हम सिर्फ कुछ पेशेंट्स को केयर अच्छे दे या वीआईपी केयर प्रोवाइड करें. We have the uniform care for all age, all sex, all religion patient in the various setting, in the OPD setting as well as IPD setting, or in the radiological examination or laboratory services. So the setting include care provided in outpatient unit, daycare facility, inpatient IPD patients, including if we have the emergency unit. So what is the critical care policies? Yeah, what you will be treat in the critical area, what are the procedure room quality, and what are the OT procedures. So all the care should be uniform, and it is not for ununiform all the patients. So hospital have the written guidance some applicable law and regulation that guide the emergency services, ambulance services, pulmonary resuscitation, how we will use if your blood transfusion. So what are the category for blood transfusion and the care in the ICU and HDU. So in all the area, we have all the hospital have the written guidance which have show in the different signages form in this respective area. So like we have discussed about in this area, in this chapter, there are in this chapter there are COP1, in which COP1 all the care delivery is a uniform for given health program and the uniform care guided by documented policy and the applicable law, regulation and guideline. COP in COP1, the we have which type of patients, the applicable law, we have the Clinical Establishment Act, we have the MLC, we have the consent, what are the emergency care, all should be mentioned. What are the legal matter and what are the statutory requirement? We have the mandate for this standards. In COP2, documented policy and procedure for homeopathic case management. So in this, there are documented policy and procedure for all activities pertaining to the case homeopathic case management. The homeopathic case management, acute as well as chronic, documented policies should be maintained and the documented policies reflect standard and principle of homeopathic practice, like you have prescribed the medicine on the basis of homeopathic principles or homeopathic fundamental. So in COP2 standards, the case management is done as per the current good clinical practice guideline. So all patients treat with good clinical practice guidelines as shown given by the rules and regulation by our CCRH, NCH, ICMR, WHO policy. So the all case management have aligned with integrated overall patient's care. Case record are documented in prescribed format, like all case record have the proper complete detail regarding the case. In standard 3, emergency services are guided by the documented policy, procedure and applicable law and regulations. So if majority of homeopathy hospital have not the emergency services, but in the current MES 2024 focus on the emergency services, because majority of the homeopathy hospitals are located in the remote area. An emergency comes without any emergency कोई बोल के नहीं आती. So all homeopathic hospital have the setup regarding the emergency services and we have the document policy which type of emergency which we have dealing, like so the organization shall be identified area in which we have easily accessible to receive and manage emergency patients. This is also addressing how the medical legal cases we have handled in the COP3. So in the MLC cases, the cases of injury, yeah, any type of RTA, yeah, any type of suiciding, yeah, homicide cases are comes. So we have the documented policy regarding MLC, inform the nearest police station and treat the patients. So cases are treated to be medical legal cases and the case paper have the entry regarding the MLC cases. In the all cases have proper documented and recorded as per the standards. So cases that are to be treated and the medical legal cases we have been identified. So In the emergency area, the triage are very important. So what are the triage? Triage are nothing but the mode of treatment in which we have given the most priority. In the triage, we have defined different type of color belts we have using. Next, standards COP4 in which the ambulance services. So what are the ambulance services? So in the ambulance services, so we have the adequate access for the space for ambulance, and we have the all related document regarding the ambulance and ambulance checklist by which we have properly checked all the equipment, all the medication, and all these things on the regular basis. Emergency medications all checked daily and prior dispatch to the ambulance. The ambulance is a proper communication system. Standard 5, COP5, the organization plan the handling community emergency epidemics and other disaster. In the COP5 standards, so the SCO, the organization identifies potential emergency like what earthquake emergency, flood emergency, any type of mass accident, civil unrest out of organization premises, major fire, invasion of enemy. So in this, the organization has a documented disaster management plan, which have the alert code, information and communication, action cards of the staff, availability of earmarking of resources, training and mock drills, which are conducted on the regular basis. In this standard, the provision is made for the availability of the medical supplies, equipment, material during the each and every emergency. So next standard is COP6, the documented policy and procedure guided by the care patient during the CPR, cardiopulmonary resuscitation. So in this standards, the documented policy and procedure guide the uniform care and uniform use for the resuscitation of patients so throughout the SCO. The all staff have the provided direct patients care are trained and periodically updated in the CPR training. The event during the cardiopulmonary resuscitation are recorded. And after the recording, if we have any deviation, so we have made plan to a corrective and preventive measures to avoid the post event analysis. COP7 deal with the documented policy and procedure guided by the nursing care. After the physician's care, then in IPD area, the nursing care is a very essential. So in this standard, the documented policy and procedure for all activity of nursing have recorded. They have recorded by proper nursing chart, TPR chart, and other things. This reflect current standards of nursing services and practices to the relevant regulation and purpose of the services. In this COP7, the assignment of patient care is done as per the good patient's guideline. Nursing care is aligned by the integrated with overall patient's care. Next, COP8, the documented procedure guide the performance of various procedure as per the scope of the organization. If a homeopathic hospital having the OT unit, a procedure room, a labor room, so all the services and all the procedures have display in the display area, and all the SOP, documented policies should be maintained regarding the various procedure as per the scope of the organization. In the standard 9, the documented policies and procedure, rational use of blood and blood component transfusion. If in a hospitals, in these standards deal with the blood transfusion. So we have the documented policies regarding the blood transfusion, and when we have the need the transfusion. If we have the blood bank, so the hospital have having the verification of the blood component, transportation and cold chain are maintained properly before the transfusion. Also, some acts which is applicable like Drug and Cosmetic Acts 1945, 10th B and 11th B should be properly maintained. In the COP 10, documented policy and procedure guide care of patient in the intensive care area. So same policy have the maintained in the ICU unit. If in these standards, the hospital SCO having the documented policy and procedure we have for the care of patient in the ICU and HDU. The organization have the documented policy regarding the admission and discharge criteria for the ICU and HDU. The all hospital staff and nursing staff and medical staff have the trained for this criteria repeatedly when in the ICU, basically focus on the infection control practice have documented for to avoid the hospital infection, and as per the infection control policy, we have also maintained the quality assurance program for all ICU equipments. So next policies, next is a COP 11 standards in which the documented policy and procedure guides the care of vulnerable group of patients. Vulnerable group of patients, that means the patient have the need care properly. So in the vulnerable group of patients, we first of all identify the patient who is the vulnerable category of the patients and how you will be care in the vulnerable of group of cases in the OPD as well as IPD. Documented policy and procedure guide in the obstetric care as per scope. So same vulnerable group, obs gynecological cases, pediatrical cases, the patient having the sedation, yeah, all the standards have the regulate. All the hospitals should follow the SOP regarding the COP, care of the patients. Next chapter is management of medication. So after the care, the important chapter is the management of medication, in which the organization is goal to organize the proper medication management. What are the availability of the medicine, safe storage, correct prescription, correct dispensing, and the proper administration of medication are governed by the written guidance and medication pathway. The organization has designated a medication safety officer because in this MOM, if it deals with the adverse drug reaction and pharmacovigilance committee. So in this standards, in these chapters, so adverse reaction and adverse reaction and designated medication safety officer have appointed. The pharmacy have oversight of all medication stocked out of pharmacy. Pharmacy के अंदर जितनी भी मेडिसिन है उसको प्रॉपर तरीके से अरेंज किया जाए ताकि वो इजीली फाइंड आउट पा सके, बिकॉज इन द होम्योपैथी वी हैव द मोर देन 3000 medicines, so all the medicines should be arranged properly. If we have not having all such medicines, we have formed a formulary which medicines we have and which medicines we have not have. The pharmacist shall ensure correct storage regarding their correct temperature to provide to separate high risk medicines like Lassa and look like sound like medicines. Proper checkup of expiry date and the maintenance are of all medicine is documented. So MOM management of medications deal with the documented policy and procedure guide the organization of pharmacy service and uses of medication. In these standards, the hospital, yeah, SCO have the designated area of dispensing of medicines. That is a pharmacy area in the both OPD area and IPD area, and how we have the SCO is use the medication, have proper display in the pharmacy area. As we have discussed about, we have the more than 3,000 medicines in our homeopathy. So we have the hospital formulary in which the hospital dispensary, hospital storeroom having the how many number of medicines are listed in the different potencies in biochem combination or other external format. So a well, and this is formulary is regularly updated quarterly to add new medicines or to discard some medicines which are not in use. So a listing of a prescription drug approved by the medical officer or consultant should be listed. In third standard, documented policy and procedure guide for the storage of medication. So a proper storage of medications is a documented and a policy is maintained where the medicine are storage. The storage area have a proper temperature, good light, ventilation, in protected from especially pest and rodent and other controls. So regularly the medicines are the storage is very the policies for the storage are properly maintained. The medication are stored in clean, safe, and secure environment. And we have the regularly monthly inventory control to manage the storage of medicine in all area. Suppose a medicine is nearby expiry, a nearby expiry date. So a regular inventory control program have avoid to make the expiry medicines. So inventory control, the officer, designated officer supervise the intake, use and disposal of various medicines and regularly check the medicine stock register and identify which medicines are regularly used. In this SOP standard 3 documented policy regarding the look like and sound like medicines should be identified and physically apart from the other medication. In our homeopathy, some drugs are look like calcarea phos, calcarea sulf, natrum phos, natrum sulf, are the look like medicines. The name of the both name are same, but the when the dispensing, the dispenser or other staff may be confused to which medicine is prescribed. To avoid such type of error, we have separate look like medicine and sound like medicines apart from the regular medicine, and we have marked some specific demarcation on the look like and sound like medicines. In next storage, in the next standard document policy and procedure guide to the safe and rational prescription of the medication. In these standards, the what are the good prescriptions? So the good prescription have what the prescription have the followed the homeopathic prescriptions format. The inscription, superscription, description, and signatures are maintained. A proper prescription have proper timing of the medication, how the patients took the medicines, all the documented, yeah, SOP are maintained. The standards 5 deal with the safe dispensing of the medicines. So safe dispensing after the dispensing, the how the patients take the medicines. In the medicines, in the labeling have the drug name, the drug strength, when the patients are taking the medicines, and if a medicine is high risk, so it should be properly explain to the patients. And apart from this, we have the explain to the patients what are the procedure, what are the administration process of the medications. So medication administration is proper maintained. And the MOM 7 deal with the after giving the medications, the patients are undergo the monitoring of the medication administrations. So in this event, near miss event, yeah, medication error, yeah, adverse drug event are reported and analyzed. If any near miss event, yeah, medication error are happened. So we have regularly audit for both event and identify what are the root cause for both near miss and adverse drug reaction, and we have make the corrective measures for this by prevent this medication adverse reaction. Document 8, narcotic drugs we are not using in our homeopathic dispensary, but in some OT area, yeah, labor room, yeah, in the emergency, some narcotic drugs, if we are using, we have the prop show what are the narcotics drugs and what are the policies for these drugs in MOM 10 and MOM 11. Documented policy regarding the chemotherapeutic drugs and radioactive drugs should be maintained, and in the both having the hazardous drugs, so to avoid the occupational hazardous exposure, so we have to separate these medicines to the other medications. So the third is chapter is the management of medication. The next chapter related to the patient's right in education, in which the organization defines, protect and promote the patient and family rights and their responsibility. The staff as well as the patient have the aware what are the rights and what we have the trained to protect them. Patients are informed to their rights and educated about their responsibility at the time of entering of organizations. Like we have seen, the majority of patients relative have the not follow the policies. So we have the clear cut, have the display what are the rights about patients and their relative. After taking the patient's treatment, the management, the SEOs show the expected cost of the treatment and care should be maintained. The organization encourage patient engagement to enhance clinical outcome, safety and quality. Patient is educated about various uh, community outbreak services like awareness activities, and if the patient having the some grievance, he have having some fault, so patient have right to addressing the grievance in the feedback box. So in these standards, the patient's PRE 1 shows the organization's patient's right, and they are informed about the what are the responsibility during their care. In the PRE2, the patients and family rights support individual belief, value, and involves the patients and family in decision-making processes. In the PRE third, the patient or family member are educated to make informed decision and involved in the care and the planning delivery processes. So all in the PRE, which is deals to patients' right, patients' educations regarding hospital, regarding management, regarding treatment, regarding consent, regarding feedback, regarding any grievance, and further communication with the patients, with her family. So in the PRE, we deal the SOP should be maintained as per the standards of the PRE 1 to 8. The next chapter, which is the last chapter related to the patient-centric hospital infection control program. So the SCO, your organization have the effective healthcare associated infection prevention and control program to avoid further nosonomical infection in the hospital. The program is documented and the aim to reducing to the infection patient as well as visitors and the healthcare provider. The program is implemented across the organization, including the clinical areas, supporting areas. So the management, the SCO have the proper HIC team which have deal regarding the standards of the HIC. So in HIC 1 and 2, the organization has a well designated, comprehensive and coordinated hospital prevention and control programs which have reducing, eliminating the risk factor to the infection to the patients, relative visitors and providers of care like stakeholders. The organization have the infection control manual and identify the high risk area of infection in the hospital, and the hospital have taken the regular surveillance activity to capture and monitor to infection and prevention and control to data. Regularly, the team has surveillance in the high risk area of infections like OT, recovery, emergency, lab, the other areas of hospital. So the organization takes the action to prevent and control the healthcare infection in the patients, because majority of hospital infection are due to the healthcare associated infection. To avoid for this, we have the hospital have the proper documented policy regarding the HIC. HIC 5 deal with the for the healthcare associated infection से prevent करने के लिए proper staff training, their regular training, their feedback should be proper maintain होना चाहिए. The organization identified the takes appropriate action to control outbreak of infection. If हॉस्पिटल्स के अंदर अगर कोई इन्फेक्शन हो गया है, फैल गया है, तो उसको आउटब्रेक करने के लिए कौन कौन से कंट्रोल पॉलिसी है, आप किस तरह हाउ द हॉस्पिटल हैव रेगुलरली स्टरलाइज या फ्यूमिगेट द एरिया. देयर आर डॉक्यूमेंटेड पॉलिसी एंड प्रोसीजर फॉर स्टरलाइजेशन एक्टिविटी. बायोमेडिकल वेस्ट, हाउ द बायोमेडिकल वेस्ट इज हैंडल्ड एंड वेयर इट्स disposal in safe manner. The infection control program is supported by the management and the included training staff. So here we have talked about the biomedical waste segregation chart. In the all hospital setup, the normal black color we have used for the general waste. The 4 color dustbin, yellow, red, white and blue, used for the segregation of biomedical waste as per the hospital uses. So next 6, 7, 8, 9, 10 chapters related to the management chapters. The next chapter is related to continuous quality improvement program. So after the patient treatment, the hospital should ensure the continuous quality improvement for the patient. So these standards encourage an environment of the patient safety and continuous quality improvement of the patients as well as stakeholders of hospital. The patient safety and quality program should be documented. What are the safety program? What are the quality program? Are the documented in all areas of the organization for the patient as well as the staff member. The management create a culture of safety for organization, both for the patient as well as the hospital staff. Patient safety officer shall be designated, shall be appointed for the implementation for the patient safety program. In the patient safety program, so in this standard, there are CQI, in some KPI, key performance indicators. There are certain monthly, quarterly audit should be done by the patient safety officer related to the area. And in this area, there are any shortcoming, the patient safety officer should make a CAPA to avoid such risk. So national and international patient safety goal solution framework shall be implemented. So in all hospital setup area, so patient safety. So in the patient safety, what are the identification, correction should be maintained in this area. So in the CQI 1 to 9, so the structure, quality improvement and continuous monitoring programs should be organization shall be displayed. There is structure patient safety program. There in the CQI 6, the quality improvement program is supported by the management under the KPI. There is a CQI 7, there is establishment system of clinical audit, monthly audit, quarterly audit, by which we have identified some area. CQI 8 and CQI 9 deal with the incident and sentinel and events. So avoid some incident and sentinel events, the proper documented policy, and what are the different area of what are the incident event the hospital, what are the sentinel events should be maintained, yeah, should be documented, and corrective plan should be shown. Seventh chapter is ROA, which is deal with the responsibility of management. So we have talked about 6, 7, 8, 9, 10 are related to the management centric. So the management of the health SEO is aware and the manage the key component up to governance. हॉस्पिटल को स्मूथ रनिंग के लिए विच जो चीजें जरूरी है वो ऑर्गेनाइजेशन प्रोवाइड करना चाहिए. Those responsible governance are identified and their rules and defined. So each in the ROM 1 to 6, the each and every staff's responsibility should be defined. What are the work of the registration clerk? What are the work of the doctors? What are the work of the AYA ward boy? What are the work of nursing staff? What are the work and duties of management should be defined. The organization have, if any complaints, ये कुछ होता है तो there is let down applicable resignations should be maintained. The services provided of each department is documented, like all OPD area, IPD area, OT area services we have to documented. The organization is managed by the leader in ethical manner. The organogram, if any complaint have occurred, so we have the proper channels for the communications to rule out this thing. The organization displays professionalism in management affair. Next chapter, patient management. So these are the organogram, like who is the first president, director, hospital superintendent, hospital OPDs, IPDs, clinical services, hospital administrations. Each have the designated area of working, so all credentials should be maintained. Next chapter is facility management and safety. So organization provide the safe water, electricity, medical gases, and vacuum system for smooth running of hospitals. The organization is a program for medical and utility equipment management. So all the medical and all equipment should be proper calibrated. Yeah, there is a proper breakdown registers. The organization plan for fire and non-fire emergency. So when a fire, so proper fire exit plan, code rate training should be documented. Organization has the no smoking area to avoid any fire and fire alarms. The organization safely manage hazardous material. The organization works toward measuring the energy efficient, that is the green energy. So all these things should be done in the FMS. So in the basically FMS, the fire safety, building safety, and non-fire emergency like code blue, code red, code purple, code violet. So all these proper documented, yeah, proper training should be required. The organizational program for medical cases, vacuum should be properly checking. Next is HRM. Next step, HRM, the most important resource of the organization, it's human resource. So all the HR have the efficient functioning of the organization. The management plan to identify the right number and skill of the staff required to render safe care of the patients. So the staff recruitment is done as per the uniform policy and standardized system. So what are the HR policies should be properly documented? What are the recruitment policies should be defined? What are the after the joining, there are the professional training or developmental program. Like I will talk about the code blue, code red, triage, hand washing, audit, the regular trainings, staff and adequate trained by the various safety related aspect. And after the year, the appraisal system for evaluating the performance of employee for the increment policies. So the organization have the documented policy for disciplinary grievance. The organization address the healthcare needs for the employments regularly, healthcare checkup for employee, their family. There are documented personal information of each staff. What are the staff, their designation, their credential should be properly documented. What are the privilege to the medical professionals should be properly documented, and credential of the nursing staff and other staff should be documented with the supervisor. The last chapter is the information management system, in which the data are storage in the both soft copy as well as hard copy should be maintained. Information management system include management of the hospital information system as well as the modalities of information communicated to staff, patient, visitor, and the community of the general. So whenever a patient, a visitor, or a staff need some document from the patient, so we have the proper channels to retrieve the document from the storage area. The goal of information management is the organization is to ensure that the right information is available to the right person at the right time. The organization shall maintain a complete and accurate medical record of every patient as per the policies. Like OPD patients 8 to 10 years, data should be properly documented. The MLC, the birth, and the other records should be maintained lifelong. The various aspects of the medical record, like content, staff authorized, make interest and retention of record, are addressed effectively by the organization. All staff should, all records should kept in the proper areas for easily recalling and retention purpose. The medical records shall be available to appropriate care of providers. The medical records shall be reviewed at regular interval. That means the all record have the all the related document to the OPD case as well as the IPD cases. So this is the IMS information management system standard 7. So it is the last chapter of the NABH standards. So thank you. Do you have any questions?
Thank you, sir. I want to extend my heartfelt gratitude to our esteemed speaker, Dr. Kamal Patidar, sir, for sharing their valuable knowledge and expertise with us today. Your insights on role of NABH standards in homeopathy have truly enriched our understanding. NABH in homeopathy is very important to improve quality care in field of homeopathy. A big thank you to all our participants for your engagement. Your enthusiasm made this session ever more meaningful. We hope you found this webinar informative and valuable. Stay connected for future session, and until next time, all the webinars are uploaded in YouTube also. please go through the YouTube channel Homeopathy 360 and you can learn from those recordings also. Thank you so much. Take care and keep learning. Have a great day. Thank you so much, sir.
Thank you.